Hi, my name is Meagan Paulk, and I'm the manager for the Center for Patient and Family Services at the Johns Hopkins Kimmel Cancer Center here at Sibley Memorial Hospital. I've worked at Sibley for 7 years, and I started as an oncology social worker. And during my time here, I've been fortunate enough to have access to Patty's Fund as the primary patient assistance resource for our oncology patients and their families. Um, as somebody who's worked in healthcare and specifically oncology for many years, I can tell you how incredibly valuable patient assistance funds are to addressing patients' access to their cancer care. The number of barriers that the average patient faces with little to no family support or financial support can feel really insurmountable. And so to have this resource is really incredibly valuable. Patty's Fund, I think, is really unique because it's managed by our team of social workers. So we're trained to meet patients where they're at. And because Patty's Fund allows us to be flexible, we can provide a number of different resources that range from transportation to housing, medication costs, grocery bills, um, all with very little front work so that patients can quickly receive the care that they need, and we can address those barriers right away. Uh, Over the years, I can really point to countless examples of how Patty's Fund has impacted the lives of my patients. I'll share one about a young mother I worked with when I first started at Sibley, who unfortunately was diagnosed with an advanced stage cancer. She had a very poor prognosis. She had four young children. They had a really poor living situation, really limited family support, and she was really just trying to manage everything on her own. And then she gets hit with this diagnosis. So we met in the cancer center, I think right before she started radiation treatment. So she was going to be getting treated every single day. And we met for such a long time, just talking about all of her fears about how she was going to get to her care, how she was going to take care of her kids, how she was going to pay her bills. And in that moment, the things that I was able to provide that mother that would quickly and tangibly impact her life started with Patty's Fund. So we were immediately able to start providing daily transportation that was fully covered by Patty's. We were able to assist with all of her out of pocket medication costs. And I quickly was able to do that the same day with just a call to our pharmacy. And we sent her home with grocery gift cards so she could right away start providing food for her family without having to worry. And I remember she became really tearful. She was just, oh, I think she was overwhelmed by everything. And also just really grateful that we could assist her really quickly. And it freed her up to be able to focus on her own health and the well being of her kids, so that she could start making those kinds of major plans that she needed to make. Um, Patty's Fund really makes it very easy for me and the other members of my team to feel like we are armed when we walk in to meet with a new patient that needs help, because we know we've got the resources to provide them with the peace of mind that they need and protect their dignity as they begin to walk through one of the most difficult experiences of their lives. I don't think there's any way for me to fully quantify the full extent of the impact of this gift and the impact you've had on so many lives here at Sibley just with this one fund. I just sincerely thank you for your generosity. I hope that I've conveyed how important you are and how important the fund is. Um, and I really hope that we've been able to honor Patty's legacy in the work that we do every day. And I just thank you so much for your continued support.